Welcome to Medicine with Dr. Morin. I am Dr. Keith Morin. In this video, I will review the importance of preparing for a colonoscopy with 1 day of clear fluids and 4 liters of PEG solution. If you have not already, I would recommend that you watch my video entitled Everything That You Wanted to Know About Colonoscopy But Were Afraid to Ask. It's on the screen right now, just click the link. This reviews all aspects of the colonoscopy and is a must-watch. This video specifically is about the 1 day of clear fluids and 4 liter PEG solution preparation. First, some humor. This is from Carla Barrett. Colonoscopy preparation. The preparation is always the worst part of the procedure for patients. Going on clear fluids the day before and the laxatives that will trigger the bowel clearing diarrhea can cause apprehension. It is worth this minor hassle to have a good look at the colon to assess for abnormalities which might include colonic polyps, which are growths on the colon. These can be benign as well as precancerous, and the other purpose, of course, is to search for colon cancer. There are many other abnormalities, though, that could be seen. The preparation is a very important part of the procedure to ensure that the bowel is clear of feculent matter and that all the walls of the colon can be well seen. How effective the prep is a critical factor for colonoscopy. It is very important to read the prep sheet in detail at least 1 week pre-procedure. There may be medications that need to be held, and it is important to avoid nuts, seeds, popcorn, as I will describe pre-procedure. You will need to purchase the medication for preparation as well. An inadequate bowel preparation has a number of consequences. It takes the colonoscopist longer to pass the scope from the rectum to the end of the colon where the cecum is. It also takes longer to withdraw the scope as areas which may be partially soiled need to be washed and suctioned. It is harder to find polyps when the colon is not clear. As I always tell my patients, it is much easier to find something in a room that is tidy rather than looking for something in a room that is messy. A suboptimal bowel preparation sometimes means that the interval between colonoscopy needs to be shortened, or if the preparation is truly suboptimal, the procedure simply needs to be repeated at the next available time slot. In other words, you have to have another colonoscopy. Suboptimal bowel preparations lead to a low likelihood of the scope being advanced all the way to the cecum, thus a lower completion rate. They also lead to a lower polyp detection rate. There is much higher risk of adverse events when the bowel is not optimally prepared, as it may be difficult to see which way the lumen is going on insertion. Sometimes large diverticuli, which are thin-walled, can be difficult to tell the difference between the colonic lumen and a diverticulum in a suboptimal preparation. Pushing the colonoscope into a diverticulum could cause a perforation. Medications prior to colonoscopy. It is important that your medications are reviewed prior to a colonoscopy. Some medications, such as iron, need to be held beforehand. Typically, iron is held for 5 days pre-procedure. Blood thinners, otherwise known as anticoagulants or antiplatelet medications, may or may not need to be held. This is done on an individualized basis. If an anticoagulant is discontinued, there is obviously a risk of a blood clot developing around the time of the colonoscopy, but this has to be balanced by the risk of bleeding from the procedure itself. Aspirin and non-steroidal anti-inflammatory drugs like ibuprofen or naproxen or Motrin may be continued safely in patients having a colonoscopy. Diabetic patients on medications will need adjustments. Typically for diabetics in general, the medications are reduced by 50% with close blood glucose monitoring during the preparation days or day, as well as the day of the colonoscopy. Even with a significant reduction in diabetic medications, some of my diabetic patients attend for colonoscopy with glucose readings in the normal range, which they tell me they never get. I always point out to them in this instance that typically patients consume less carbohydrates during the preparation than in their normal diet. Thus, their blood glucose levels would be much lower, as carbohydrates are broken down into glucose by the intestinal. This is why we reduce diabetic medications. I tell diabetics that it goes to show them if they want to do a lower carbohydrate diet when they transition back to solid food after their colonoscopy, they could have much better diabetic control going forward with much less medication for diabetes. This is an excellent opportunity to explain to diabetics the importance of a lower carbohydrate diet in order to reduce their dependence on their diabetic medication. Many diabetic patients on a low-carb diet can in fact reverse their diabetes, lose weight, and subsequently develop normal glucose control. Colonoscopies do have risks. There have been multiple studies looking at complications over the last 20 years. Serious harm is approximately 0.2%, which is 2 in 1,000. This was seen in one meta-analysis. A meta-analysis is a technique of synthesizing research results by using different statistical methods to put together results from previous separate but related studies to draw an overall conclusion. Serious harm in this meta-analysis was related to post-procedure bleeding or perforation. In the vast majority of instances, this was seen only when a polyp was removed. Commonly quoted risk for colonoscopy is 1 in 2,000 of perforation, 2 in 1,000 risk of postoperative bleeding, which is typically secondary to polypectomy, as I've just mentioned. Death is 3 in 100,000. While these risks are infrequent, they may require urgent treatment or even an operation. Risks are obviously much higher in older patients who would have other medical conditions such as heart failure, chronic lung disease, heart rhythm abnormalities, stroke, or cancer. Risks related to sedation are very uncommon. The bowel preparation itself can cause side effects including nausea, vomiting, bloating, and rarely fluid or electrolyte abnormalities. Sedation is given through an intravenous for the majority of patients having a colonoscopy. Approximately 10 or 20% of my patients will have the test carried out with no sedative medications. If they do, they are able to talk with me throughout the procedure and watch the findings. Some patients have discomfort during the test, and so conscious sedation is what is given to alleviate anxiety and discomfort in the majority of patients. Conscious sedation, which we give for colonoscopy, is not general anesthesia. General anesthesia is where a coma is induced and you are temporarily put on life support ventilation while a surgeon is performing an operation such as an appendectomy or cholecystectomy. Conscious sedation is a much lighter level of sedation to keep you comfortable and relieve discomfort that you might have. You will breathe on your own, and if we need you to change your position during the colonoscopy, you will be able to with my and the nursing staff assistance. Note that we sometimes need to change patients' position in order to facilitate the passage of the scope through certain areas of the colon. Most consciously sedated patients have no memory of the test, even though you may have some vague awareness at the end of the procedure. Next is the consent. Before the procedure, I will speak to you outlining the procedure in detail. I will review the nature of the procedure, the benefits, the risks, and any relevant limitations. Please do not hesitate to ask any questions that you might have. If there is any change in your health, new medications, or if you might be pregnant, this must be brought to my attention. Some general points. Arrive for your colonoscopy 1 hour pre-procedure. You need to bring your health card and a list of your medications. Leave your valuables at home. It takes time for you to be assessed by the nursing staff and prepared for the procedure with an intravenous and appropriate attire. It is important if there's residual fluid in the colon that you go to the bathroom to evacuate the fluid. Once we take you into the endoscopy suite and we are ready to start, we position you right up on your left-hand side and you will be facing the screen. If you are having this done unsedated, you will be able to watch and talk to me throughout the procedure. If you are not, we will give you sedative medication at this point. Colonoscopies typically take 15 to 25 minutes if there's no significant pathology found. It can take much longer or even up to an hour if there is significant pathology. This can occur if there are multiple polyps, a large polyp, or other complex interventions needed to be done. While we make every effort to be on time, elective cases can take longer than expected, and sometimes emergent cases take priority. I always recommend that patients bring something to read and be prepared to wait. Patients typically are discharged 20 to 60 minutes post-procedure. If needed, blood work will be done post-procedure. Additional imaging, if needed, for further workup of your symptoms will be arranged at that time also. I will speak to you post-procedure. If you wish me to speak to a family member as well, I am happy to. Let the nursing staff know this. I will give you a discharge sheet when you leave, which will circle the relevant findings of the colonoscopy and the follow-up plan. If you did not receive sedation, you can go home immediately after the procedure once you have changed, and you can drive and go about your day as you normally would. If you received sedation, you must have a family member or friend to take you home and remain with you. You cannot drive, operate machinery, or make any major decisions for the rest of the day if you receive sedation. Most patients have no discomfort after the colonoscopy. Very few may feel some bloating due to residual gas. We use CO2, carbon dioxide, which gets absorbed very quickly, and so the bloating should subside with the passage of gas, usually within an hour or two at the most. Most patients can resume a normal diet after the procedure. If you have any abdominal pain, bleeding, such as more than 2 tablespoons per rectum, nausea, vomiting, shoulder pain, or fever, do not eat or drink, and please attend the emergency room. In the unlikely event that you do attend the emergency room, please let my office staff know. This is from Lynch. Four days before the colonoscopy. Avoid nuts, popcorn, seeds, which would also include multigrain bread, fruits or vegetables with seeds. Seeds can stay in the colon for several days and can make it difficult to suction puddles, as the seeds will get caught up in the suction channel and prevent me from sucking fluid. Avoid iron pills if you take them. Iron can make the stool black and thick and difficult to purge. If there is any residual feculent material, it can make visualization difficult. After all, we are looking inside the dark tunnel called the colon with a light and seeing puddles that are dark or walls that are partially coated with black feculent material, and this obviously makes it visually more difficult to see abnormalities such as polyps. Consume clear fluids only with no solid food from this point on up to 2 hours pre-procedure. Studies show that drinking liquid up to 2 hours pre-procedure is safe and that there are no significant residual liquids in the stomach 2 hours before the procedure. Make sure you drink plenty of fluids, approximately 3 liters for the day. Fruit juices without pulp such as apples, sports drinks such as Gatorade, clear soup, chicken broth or consommé. Also, popsicles, jello, honey, pop, black coffee, and black tea are acceptable. Do not drink milk or any red or blue or purple colored drinks. The dyes can discolor the lining of the colon and make it harder to visualize abnormalities. Medications can be taken with a sip of water the day before colonoscopy as well as the day of the colonoscopy. During the preparation, review your preparation instructions well to ensure a clean bowel. Purchase a wide variety of clear fluids to drink. After a bowel movement, use medicated wipes such as baby wipes or wipes with aloe or vitamin E. Use a zinc barrier cream to prevent perianal skin chafing. Set up shop in the bathroom. Bring in books, magazines, a laptop, tablet, or cell phone. Play music. Remember that you're drinking chilled liquid, and so your body can get cold from it. So therefore, dress appropriately. To lessen nausea that you might get from the preparation, drink it chilled with a straw. Place the straw as far back in your mouth as possible and swallow it quickly. You can hold your nose and drink it as quickly as possible. Some patients find that sucking on a lime or lemon slice after you finish can be very helpful. A lime or lemon under your nose while you drink can also be helpful. Sugar-free menthol candy drops to suck on also can be healthy. If you're having trouble, you can temporarily interrupt the regimen for 30 to 60 minutes. Wear loose clothing and stay near the bathroom. Now for the preparation instructions. The day before the test in the morning, take bisacodyl 10 milligrams by mouth. This is a very mild laxative and will not induce diarrhea. You can go to work this day. Starting around 5 p.m. or as late as 7 p.m., drink 2 liters of the chilled PEG solution over 2 hours. You will need to go to the bathroom typically 30 minutes after starting to drink the PEG solution. After drinking this, chew 2 tablets of simethicone. These are usually 125 milligram tablets. The simethicone will reduce bubbles within the colon, which allows for better visualization during the colonoscopy. The day of the test, 4 to 5 hours before the test, chew 2 more tablets of simethicone and drink the remaining 2 liters of chilled PEG solution. Then you can take clear fluids up to 2 hours before your colonoscopy, as I previously mentioned. Please follow the instructions carefully. Remember that adherence to the instructions improves the quality of the examination both for you as well as for me. You can pause the video here and take a picture of the screen with your cell phone camera if you want to look at the instructions later. I hope this video was very helpful in your colonoscopy preparation. Click like if it was. Click subscribe and hit the bell for notifications. I produce many new medical videos on different topics. I am Dr. Keith Morin. You have watched Medicine with Dr. Morin. Get healthy and stay healthy.